In the elderly, the infections are particularly common in patients with comorbidities. And comorbidities, of course, increase with age. So it's not at all uncommon to deal with patients that are on 3 or 4 different pills because they have hypertension, because they have diabetes, because they have hypercholesterolemia, maybe they are depressed and they are under antidepressives, etc. In this context, it's very important to keep in mind that a given antimicrobial can interfere with the metabolism of other drugs, and this can be a cause of side effects and even toxicity. As I said, comorbidities, multiple comorbidities are not an uncommon situation in the elderly, and this is where we physicians have to be much more careful at the time of prescribing antimicrobials. First step is to be sure that the person needs to be treated with an antibiotic and that the infection that we are trying to cure is not a viral infection. The second point is to be sure that what we select is the optimal therapy for a given clinical syndrome. And third, and this is the point that I like to insist upon today, is that this population commonly are taking other drugs, and interactions are very important. Just to give you an example, if you use an oxazolidinone, this can clearly interfere with serotonin inhibiting drugs. And as in this population is not uncommon to be under certain antidepressants, this could be a cause of toxicity, specifically the serotoninergic syndrome, which can be pretty severe and is something that of course has to be avoided. Likewise, this population not uncommonly have impaired renal function. So at the time of choosing the right antimicrobial, it's very important to know what is the renal function to be sure that the antibiotic that we administer, if it's only eliminated through the kidneys, is not going to get into a toxic levels for not having taken into account this particular situation. Other examples, of course, are patients with chronic liver disease, at times severe, patients with cirrhosis, where the same consideration applies. Many of the antibiotics we use are metabolized, or at least partly metabolized, by the liver. And in this particular situation, dealing with a patient with a chronic liver disease, again, we will have to take into account the metabolic route of this particular antibiotic to be sure that the dose that we administer is the right one.